Concern is the most important skill in the exam. Why? We have concern in station 2 in history, station 4 communication, and 2 cases in the station 5. Concern is about 16 marks. 16 marks. In each station, 4 marks. 4 marks in history, 4 in communication, 4 in the first case of clinical, first case in station 5, and second case in station 5, also 4 marks. If you lost 2 concern or 2 stations concern, you will not pass the exam. So concern is a most important skill. You have to manage it in the right way and to answer it clearly. Now, we mentioned introduction, main task, concern, then end of discussion. End of discussion, it is very, very important because a lot of candidates forget it. And during our lecture today, I mentioned that check understanding in the manage patient concern scale. It is written in the mark sheet. End of discussion. Number 1, you have to summarize the discussion and emphasize about important notes by saying to the patient, I will summarize now the important note in this discussion. Don't give more time for summary, just to highlight the important note. Don't repeat the discussion again. You are in this area, you have to we are going to tell the examiner about that we make summary, not more than this, so that you take only some few seconds, not more than 30 seconds. I am going to summarize for you most important issue today. You were admitted to the hospital by chest pain, and we make tracing of your heart and imaging in your lung. And I'm sorry to say to you, we found that blood clot inside the blood conduit of your lung. And as I told you, we'll admit you to the hospital and we'll give you medication. This medication will make thinning of the blood, and will admit you until we reach your blood thinning to the therapeutic range, and they will discharge after that and follow up in outpatient clinic regularly. This is the summary, not more than this. Second, we'll tell the patient, I appreciate we have covered a lot of issue today. Is there anything you would like from me to repeat it again or to go over again? The patient will reply, no, actually. Check understanding is very important. You will tell the patient, I hope our discussion is useful for you. Can you tell me how much you get information from me? The patient will tell you about the issue he want or issue he understood it during the discussion. So that it is very, very important to check understanding for the patient. Number 4, help. You have to offer help to the patient, like these websites and leaflet, brochure and videos about your condition, about pulmonary embolism. You have to read it, and if you have any question or any inquiries about your problem, this is my contact number. You can contact me at any time. It is a help. Again, this is a standard. Each case we have to do that. Each case. But in case of this, don't mention the patient, I will give you a website or brochure about this. It is not practical. Okay? Or number 4, help. Number 5, we'll tell the patient, I hope you have found our discussion useful to you. Do you have any further question or concern? It is one of the important question here. I hope you have found our discussion useful to you. Do you have any further question or concern? Maybe sometimes there's a hidden concern you didn't discuss, and the patient wait to repeat it again for him. So that it is very important to ask and repeat again for the patient. Do you have another concern? Then thank you for the patient and shake hand. So, end of discussion, we have 6 items. Number 1, summarize. Number 2, ask the patient if he wants anything to repeat it for him again. Number 3, it is check understanding. Number 4, help. Number 5, do you have any other concern? Number 6, thanks and shake hands with the patient.